What I'm going to do is introduce myself. I don't think I've done that yet today, and I think I'll have each of the panelists introduce themselves, and then we're going to be posting questions, and hopefully some of those are the ones that you've submitted to us. We have until about 4 o'clock for this particular section. I'm Joel Mowrey. I'm the Director of the Mental Health and Recovery Board of Portage County. And to my right.
Good morning. I'm Dr. DePerro, Coroner of the county. It's good afternoon.
It's Hart, a person in recovery.
Renee, Klaric, the University Hospital's Addiction Services Manager.
I'm Doak, the owner and operator of Doak's Bed and Breakfast, also with Portage County Jail.
I'm KelliJo Jeffries. I'm the Director of Portage County Job and Family Services.
And as the sheriff does point out, he does have the biggest treatment facility in Portage County, so for drug addiction and mental health, and that is not a lot, unfortunately. Okay.
Okay, so this afternoon we have some questions that we kind of gathered around to ask the panelists first. Karen Hall and I from Mental Health Recovery Board are going to kind of take turns and ask those questions. If you do have some questions that you want to be asked, you write them on the colored piece of paper and kind of hold them up. Karen and I will come and get those. So the first question is for Dr. Joel Mowrey. What has been successful in the county's response to the opioid epidemic, and are there any new developments you would like to report?
Thank you. First of all, our slide here is the Mental Health and Recovery Board. Just so you know, we primarily are a funding agency, and we fund primarily 4 agencies: Children's Advantage, Home and Professional Services, Family Community Services, and Town Hall 2. One of the things that we've started through Town Hall 2 is an addiction helpline. So the people who have questions can hopefully find help, say, where do I go? Do you have the service? Where can I get the service? Project On, we've been doing with the health department. This is the Narcan, and with both funds and training out in the community with the health department and mental health and some of our other agencies, we're saving lives. We've had a Portage Substance Abuse Community Coalition officially for the past year, because that's when the name came about, but it's actually been meeting for, about 5 years at this point. And this is really to get people together from all aspects of the community to talk about our addiction issues. We do prevention in the schools. We do detox. Renee's going to mention a little bit about UH. We also, if need be, we can pay for some detox outside the county. We have outpatient assessment, individual group counseling, intensive outpatient. We're working to expand. One of the things, we have a grant recently that we received for more recovery coaches, or we call them peer support specialists, people in lived recovery that can help others. Medication-assisted treatment is another thing that we're trying to expand. Currently, Coleman does some at this point. Town Hall 2 will be starting up a clinic as well, which would be both for Suboxone as well as Vivitrol. We also have residential treatment for both men and women, as well as recovery housing for men and women. And we work very closely with the jail, and with we do have a new specialty docket drug court in Portage County. So we're really trying to work on expanding the MAT, the peer support specialists, as well as keeping the other services we have. Thank you.
The next question is for KelliJo. We understand your department, the Portage County Job and Family Services, is experiencing a dramatic increase in children in custody, from 150 in 2015 to already 215 this year, mostly due to the substance abuse in the home. We understand that your department has been proactive in developing several new initiatives, and can you tell us a little bit more about the independent living programs?
Unfortunately, because of that number, we're seeing more teenagers in foster care emancipate from our care. So they're not going home before they become adults. And so because of that, we have about 40 teenagers between 16 and 18 right now that we're aggressively working with through an independent living initiative, where we hired an independent living coordinator that works hand in hand with our children's services workers. We have a case management team in our jobs and training division. So it's really a wraparound effort with that independent living coordinator that we're all at the table creating wonderful plans for these young people to give them some type of hope and direction for their future after foster care. And so again, we bring them together twice a month as a group because they peer support each other. It's a travesty to be a teenager in foster care and crave that sense of normalcy and family. And so we're really focused on preparing them. We're really excited about Coleman Professional Services and their new housing initiative, where we hope to engage in a contract with them so we can secure apartments for our young people as they transition out. So lots of success stories. We have kids going to college and Job Corps. We're replacing children in apartments. But the sad reality are the unseen victims of this are that they're not able to reunify with their families. So we recognize that, and we're doing our best to be that family support that they so need because of this epidemic.
The next question is for Sheriff Doak. How has the epidemic impacted the jail? What's that address this?
We are in the process now, hopefully, in the process of working with architects, and the game plan is right now to break ground to add 133 beds to the facility starting this coming spring. That's a result of female overpopulation in the jail, which has gone on for the past 4 or 5 years. Does that answer the question?
Yes, thank you. Dr. DePerro, the number of deaths by accidental overdose has been rising in our country, or our county and our country. But here in Portage, from 5 people in 2011 to 46 last year. Do you believe that the efforts with Narcan are making a difference?
From what we've seen in our office, the curve seems to have slowed a little bit. We are starting to see a reduction in the number of deaths that we have to process from accidental overdoses here in Portage County. So, extrapolating on that a little bit, for every death that we see that comes through my office, we are told there are 40 overdoses that do not die, that survive, and that there are 400 people who are suffering from substance use disorder. So the numbers are staggering. I believe that Narcan has had an impact on slowing the rate of deaths that I see in my office, but I can't speak to whether or not we're still seeing the overdoses and the numbers that we are seeing out of the community. And I would just remind you that the deaths that we process technically happen in our county. If somebody from our county, one of our citizens, should go to another county and overdose, we might not ever know about that in our office. The state of Ohio has put together an electronic death reporting system that hopefully, once it's fully integrated, we'll be able to mine that kind of information so we can better focus our attention. That answers the question.
Yes, thank you. Renee, the addiction service program at UH has been up and running for about a year now. Would you tell us how the program works and some of the treatment successes you've experienced with your clients this past year?
Addiction Services Program at UH is a little bit different. It's a voluntary program. So when one says, I'd like to stop using and become engaged in treatment, they call us on the phone and we take them in a pre-screening process. We're also going to treat them with Suboxone treatment, so they have to come in withdrawal because they will be given Suboxone for the opiate withdrawal. And in about 3 days, because they're already 24 hours in withdrawal, they're on Suboxone, and so they leave on Suboxone, and they go straight to a primary medicine doctor whose specialty is in addiction. So there are no fragmented treatments, and that's really where a lot of success is coming from, because they're treated with Suboxone. They want to stay on Suboxone. So the handoff is from our services right into the doctor's office within 24 hours so that they can continue treatment. And then we set them up throughout with counseling, with whatever supports they need, individualized treatment in the area where they live. And so for us, success is patients are calling on their primary care physician who's doing all their treatment, because they're also treating their over 70 co-occurring disorders that come with addiction. And so you need that comprehensive treatment to keep people using their medications and continuing their medications for sustained treatment.
Okay, thanks. And Joel, would you flip the slide? Thank you. That's okay. All right, so our next question here is for Kelly Hart, who is in recovery. And we know that relapse is a normal part of recovery. Can you share a little bit about your experience with relapse and your road to recovery?
Well, if we become a little bit more open-minded about the word relapse, I mean, right away we think about drug addiction when we hear the word relapse. But the reality is that everybody in this room at one point or another has relapsed. I mean, if we think about our New Year's resolution, we join a 2-year membership at the gym, do great for 3 months, then all of a sudden we're paying for this 2-year membership and we're no longer going. We've relapsed. Nicotine, we try to quit smoking, cigarettes. We struggle with going back and forth. We've relapsed. But the problem with when we refer to drug addiction is we become less compassionate. We're quick to be really judgmental. So for myself with the experience with relapse, of course I've relapsed many, many times. And I found myself, when I got to that big bottom that we all talk about and hear about, when I decided to seek treatment, it took several different levels of treatment for me to finally understand and comprehend what the disease was doing to me. I went to Compass Recovery in Portage County. I went to the Root House in Portage County for 90 days and still found myself in a relapse situation. But every time I went to those treatment facilities, a bigger seed was planted. So when I hear the word relapse in a recovery situation, I have more compassion and decide to try to help a person rather than be so judgmental, give them further treatment. What else can we do? Follow a different route of treatment or like medication assistance. I'm just going to say that to be more compassionate when we're talking about relapse, and if we know somebody or have dealt with it personally, to just treat it, to continue treatment and seek other areas to where you can, it doesn't just stop with, stopping the drug use. There's a lifestyle change that goes along with it, and it takes a long time to learn that new habit. I've used for 25 years, and all of those habits were my lifestyle. So to learn a new lifestyle was a process. Thank you.
Okay, I think this question will be for Joel. Are there any plans to implement intervention teams, such as those started in Summit County, post-Narcan OD follow-up with EMT, sheriff deputy, and Orienta counselor, and to encourage seeking treatment?
We have been in discussions about some of them called quick response teams, and these are teams, as Becky has talked about, is after there's been an overdose, and particularly if the person is reluctant to go into treatment, and often they refuse even to go to the hospital for treatment, is having a team reach out, which typically is a police officer, an EMS worker, and somebody in addiction that can reach out to the person, and often it's somebody who's in recovery themselves who can reach out to the person. So, yes, we do not have it at this point in Portage County, but it's clearly something that's been it's been recommended, something that we're looking at doing, and as I alluded to earlier about having a grant that we have to increase our number of peer support specialists or recovery coaches, and we see that as being part of their responsibility to be able to do that. So we'll be working in the community to achieve that. We've been in touch with other counties that already are doing it, because we'll learn from them, both from what works for them and some of their mistakes as well. So it's in the process.
Okay, the next question is for Kelly. Two-part. When did you decide you needed help, and what facilities did you use, and did you know all of those services that were available to you at first?
When I decided I needed help that's tough. I mean, it's different for everybody. For me, it took, as you saw on the screen, full life support. And still, that was not my bottom. I was homeless. My family no longer wanted me around. I wasn't trusted, living in a tent. When I had a home to go to, I chose to use that or do that instead of, like we saw on the screen earlier when Christina put up, I chose drug over food. I guess everybody has their own bottom. For me, that was my bottom. And it took my family and loved ones to seek treatment for me. They gave me numbers to go to, like Compass Recovery is an outpatient facility in Portage County. I chose that first, and a seed was planted. I was able to call the root house, and I was accepted there for 90 days, and a bigger seed was planted. And then introduced to Alcoholics Anonymous, where everything took place, and I started to learn and change.
All right, this one's for Sheriff Doak. Does Portage County Jail allow inmates to take Suboxone if prescribed? This person's been told that if they are prescribed Suboxone, they will not receive it there. They are instead treated with painkillers. So the basic question is, do you allow people who are in the Portage County Jail to take Suboxone if they have a prescription for it?
I don't believe so. That's a medical condition, and usually they are assessed by our medical staff there. And we also have a medical doctor that prescribes med, as well as a psychiatrist who helps out.
Okay, Renee, you might be the best one for this question. How do people on methadone get off of it or stop taking it? I guess probably the same for Suboxone, if you could answer that also. And does it show up in a tox screen?
Yes, because there is an opiate, so it will show up in the tox screen when it breaks down. But the question would be, why would you want to get off methadone in the first place? Methadone is a very powerful drug, as Dr. Dallas Ray has pointed out. And to come off that drug, what are you replacing that drug with in the brain? So the brain's going to crave that same opiate for a long time. So your question is, why would you? Unless you want to switch to Suboxone, you want to try different drugs so you're not as restricted by going to the methadone clinic, you can do that. But Suboxone, any drug that you take that's opiate-based is going to show up in a drug screen.
Okay, and the last question we had submitted, and hopefully we'll have a few more if anyone has any questions. Just write them down, please. This is for Dr. DePerro. It's talking about how you determine the cause of death. If somebody has a heart attack, is it a heart attack if they were also using drugs at the time, or when is it determined that it's a drug overdose instead of a heart attack?
That's not an unusual situation. So part of the complications of this epidemic that we're experiencing is that the judicial system, the prosecutor in the county, in order to prosecute somebody who's provided the illegal or illicit opioid, would like to have and needs an autopsy on victims of opioid overdose. So even though I may walk into a room and find a 24-year-old with a needle in their arm with the remnants of heroin next to them, an autopsy is indicated. Legally, they want to be sure that it was indeed the opioid that led to the demise of this young person. Medically, we're pretty certain we know that it was, but still we can't say that with enough degree of certainty to satisfy the court system. So that's sometimes a question. When I have a 55-year-old who is overdosed and is lying in bed dead, even though we find the heroin next to them and it's obvious that they were using in their last moments, we're not always comfortable just saying it was a heroin overdose when we do the autopsies. The National Association of Medical Examiners, per protocol, does advise us to obtain autopsies on all overdose victims. In general, the policy is to regard those individuals as an accidental death, not a conventional death, not a suicide, not a homicide. Now that goes into the purview of the prosecutor. Even though we identify it as an accidental death, the courts can look upon the motive and cause of death differently. But so drug tests, we test the blood, we test the urine, and we see what level of drug is in the system. And we have lethal dose levels of drug that we can assume led to the cause of death. So the concept is, but for the drug in their system, they may have never had a heart attack. So even though they may have suffered a heart attack, it may be due to the fact that they were overdosing on some sort of medication. And it's gotten more complicated. As you all know, we now have these opioid analogs, fentanyl, carfentanil, 1,000 times stronger than morphine. A snowflake amount can be deadly. We had drug dogs, not in this county, I don't believe, but around the state, succumb to it, sniffing. We've had first responders that have to be retrained when they walk into an overdose situation, that they step back out and put on their personal protective equipment, because we've had individuals become very ill and die in this country unintentionally touching carfentanil. Just had a case in Stark County that we saw this a few months ago with several nurses who were in the emergency going in to clean up afterwards after a patient was there with an overdose who became very ill. So the complexities of this epidemic go far beyond what we're able to talk about here at length today. And I appreciate everybody at this panel and the talk, the speakers that we've had. And I want to thank Joel and the board and putting this together for us. I hope we can go out and be emissaries and light to the community. While I'm here, since that was the last question, take a moment here just to address medication-assisted treatment from my perspective, being a practicing physician, dealing with people who have substance use disorder. You may have heard me say this before, but I've yet to sign a death certificate for somebody who's overdosed on Suboxone. No, it is not a perfect remedy to a serious disease, but neither was insulin 40 years ago. And if we would have just restricted ourselves and said, well, we're not going to treat you because you're not losing weight, you're not modifying your diet, you're not doing all the things we want you to do, and by the way, we're not going to go look for better treatments. A lot of more people would be dead from diabetes today. We don't deny those individuals their medicine, so we don't stop looking for a better treatment. Today, I would say 75% of my patients who required insulin 20 years ago don't require insulin anymore. So we've made those kinds of advances. And my hope is that, well, my obligation is to try and keep them alive. So as long as we can do that, we offer hope both to the patients, to the victim, and to their families. And maybe, as we put more emphasis and more money into the system, we'll find better treatments that are more inclusive for people. But in the meantime, I have a number of patients in my practice who are on Suboxone. One young woman I asked once, 7 years on Suboxone, I said, does that trouble you? She said, I can take care of my kids. I can work every day. She said, I know that I'm in here. And that was enough for me.
Thank you. And continuing on the medication-assisted treatment theme, we did get a few more questions. So maybe Renee might be the one to take the first go at this one. It seems like you're saying that these drugs are for life. Is there a drug-free model for healing the brain? And when will the user be able to get off methadone or Suboxone? And then another question that's kind of related, are there enough primary care providers who have the Data 2000 waiver to provide MAT in Portage County?
First, let's start talking about Suboxone and what the brain, what happens in the brain. When you're barraging your brain anytime with such powerful drugs, you are changing the brain. When we put people on medication such as Suboxone, the first thing they say to us is, I feel normal. It normalizes the brain. So if you're taking Suboxone and you're 5, 7 years down the road, think about what else Suboxone does. You don't have to worry about triggers, and you don't have to worry about relapse as long as you take your Suboxone. It's like any other chronic disease. You get up, you take your medication, and you don't have to worry about your chronic disease. That's it. So when someone says, I want to come off the medication, what they're running the risk, and we talked about trauma earlier, and we're running the risk of that amygdala part of the brain that is unprotected. So if somebody goes past something that reminds them of something, their brain could be hijacked in 2 seconds, and all the strides that somebody made for 7 years could be gone in an instant. And I would say, would you want to take that risk? You could try other medications. You could try naltrexone daily. There's another medication you could try, but it's risky. At this point in time, no, we don't have a perfect remedy, but as long as you take that medication every day, you don't have a problem with it. The difference between naltrexone or Suboxone and methadone is stronger to the point where it can arrest your breathing. So it has to be more regulated. With Suboxone, at about 16 milligrams, it peaks out and that's it. So you're not going to get any more effect from it. That's why it's a rather safe drug. And if people look at it in that way, that this is just a daily medication for a chronic disease, they won't have a problem with that. But as in chronic disease, we talk about relapse. You have a higher relapse rate for diabetes than you do for addiction. Why? I need food every day. So I have to choose my food. I have to diet. I have to exercise. So that's a very powerful model, is to say, take your medication, because that's chronic disease management. We have a chronic disease. We have medication for a chronic disease, and then we tell people, well, don't take the medication. It's almost contradictory. So if the medication works, and the medication helps you maintain and manage your chronic disease, why wouldn't you take your medication? So it's for primary medicine doctors, that University Hospital is beginning to build their network of primary care physicians that also treat addiction. So that's a growing model, and that'll be growing throughout the healthcare industry. In the state of Ohio, we are now training doctors for free to get their Suboxone license. And with that Suboxone license, they could treat the first year, as they said, 100 and 275 patients. Well, we're going to need a lot more treatment providers. Why? Because of capacity. We are limited in capacity in the current way we treat addiction with the current healthcare system and behavioral healthcare system. What we're doing is expanding the capacity for treatment into the primary medicine physician. And that's really the driving force of what we're doing. So people say, oh, this way is good, that way is not good. There is no one good way. It's like when we get a patient in, what lifestyle? Do you have children? What can you do to manage this disease? And that's the question, and that's how treatment should be grouped around a person's lifestyle and what they can and cannot do, and that's what we're trying to do.
Thank you. Joel, I think this one might be for you because you said the word. Why is there such a gap between the judicial courts and the mental health field here in Portage County, and what exactly does the drug court offer?
Yeah. Well, let's go to the drug court offer. But before that, I do want to add one thing to what the first question was about sort of like non-drug efforts to get people off of whether it's alcohol, opiates, and so on. And people still do go through detox and not come out of the medication at all. We think it's a lot difficult and a higher rate of relapse, but that's still possible and people still do that. So we support that as well. They can do that at university hospitals as well. And there was a question about the providers and so on. I know university hospitals, they do have a doctor in Manaway that they work with. And we're all working with Town Hall 2 and getting their medication treatment set up with the help of Conquest, which is out of Stark County. So we still have to get all the DEA regulations and the Ohio Pharmacy and so forth. So, but the question was about the drug courts. We actually do have both a mental health specialty docket and a drug court specialty docket, meaning they're certified by the Supreme Court in Ohio. And really the model for both of those courts are really, the judges are very involved. We have Judge Oswick in the mental health and Judge Doherty in the drug court. And it's really working as a team with that individual in terms of saying, we want you to succeed. It's a voluntary program, but we're going to treat you with respect, dignity, and yes, there's some serious consequences if you choose not to be in the program and you relapse. Yeah, there could be some consequences like jail time, but ultimately it's still like, let's get you back on track, stay in treatment, what can we do to help you? So it's really more of a helpful kind of a model where really we have the probation system, the probation officers, as well as the judges working with the treatment team together to help people.
Thank you. This is to anyone who wants to take it. You've given us an update on what we are doing in Portage County. What aren't we doing that we should be?
Getting funding.
The sheriff's always about the money, but he's right. That's the problem. On the positive side, here at Portage County, we have a budget here at the Mental Health and Recovery Board that's a little over $6 million, 6.5, but over $4 million of that, about 70%, thanks to the voters of Portage County. We have 3 local levies, and we appreciate the support over the years for those. Because we got major cuts 2008, 2009 from the state. We never got those funding back. But it does come down to funding because people say, well, why don't you have more treatment facilities like Root House and Horizon House? We'd love to. We're trying to work on those, but there's only so much money. The sheriff is always saying, can't we put some of those people someplace else? It's like, yeah, we think people should not be in the jail. That's not the appropriate place. For some people, yes. If they're violent and aggressive, I want them locked up. But otherwise, we want them in treatment. We feel those things can work. So, yeah, we are working together. We're trying to do that, and finding more funding is always tough, but we're still working on it. We get little pockets of money here and there with some grants that helps, but it doesn't help sustain it in the long run. So we're still working together.
Okay, the next question is for KelliJo.
If I could just make a comment.
Oh, sorry, yep.
If I may. First of all, I want to throw the sheriff a bone over here because it is about funding for county. We're sitting in a county with a jail that's overcrowded, and at any point in time, there could be a federal decree about that. So he's trying to do the best he can with limited resources. I've had the pleasure of working with the sheriff over the last couple of years on getting the expansion of the jail started, and he's been very conservative in that regard, I think, trying to only do the very finest things. But it's the other things that could be done in this county. I think we all have to decide that we're going to go out and educate those amongst us who do not understand this epidemic, who do not understand that this is a disease. This is not a character flaw. And we have to bring addiction out of the shadows. We have to eliminate, to the best of our ability, the stigma, so that people like Kelly will come forward and be able to seek treatment in a non-judgmental way. And I think the people in this room all know that. You have to go out and be our ambassadors. You have to go out and convince those naysayers amongst us and educate them as to what needs to be done.
Okay, back to KelliJo. What does the agency do when the kids are using with their parents?
here, and I don't think that we've interfaced with a youth, at least not to my knowledge, that's been using heroin with their parents. We do have youth that use, but we would still adopt the same treatment model as we do with the adults. We definitely would provide a lot of support systems around them, but we believe in the mental health model and the medical model, and so we would apply that to them. The hard reality is sometimes substance use is learned behavior, and our young people do see it in the homes. And so we would want to try to work with them from a clinical capacity, to look at different means to cope with their stressors, and drugs and alcohol is a very big issue with our young people. So a lot of education, a lot of support, and definitely treatment. I don't know if that answered the question.
Okay, I have a stack here, Sheriff, that are kind of about the jail. So I'll just kind of sum them up and go through them quickly, and we'll see how we can answer them. A lot of them are pertaining to if someone has a prescription for Suboxone, why can't they take it in the jail? If they're a diabetic or a heart patient, can they take their insulin or their heart medicine? Does the jail help people through detox? And yeah, I think that's kind of the summary of the questions here.
Okay. Let me start by saying, what we operate as a jail, it's not a mental health facility. By default, it has become a detox facility. It's a jail. When individuals come in there, if they have medication, typically we take that from them. They are medically assessed by a medical team as soon as they come into the facility. Any drugs that they are given inside of the facility are prescribed by an in-house doctor or the medical staff. We do not, to my knowledge, permit them to use Suboxone right now. I'm not sure if that might change off in the future. There's been talk about it, but that's down the road. And again, unfortunately, it's a jail, and we daily watch people detox in there. It's not a pretty sight, and it creates a lot of behavioral issues for myself, the staff, and everyone concerned. So I'm not sure if that answers the question. The medical end of it, we do not permit drugs to come in for numerous reasons. I will be the first to tell you very openly and honestly that most jails in Ohio are dealing with drugs coming into the facilities. And I think that any chief or sheriff that tells you that that's not going on in their jail better take a look at what's happening. We have people who are bringing drugs into the jail in body cavities. We're constantly monitoring what goes on back there because of the abuse of drugs. So that's a problem for us daily. So we really monitor what's going on with prescribed drugs.
Okay, thank you. Yeah, we just have time for probably one more question. If we didn't get to your question, I apologize. Please feel free to send us an email. Come to our coalition meetings. We would love to continue the dialogue. And here's the last question.
Okay, for Kelly, what services do you wish were in place or would be in place now, which would have additionally helped you to get into recovery or to maintain your recovery?
Additional services, well, it boils down to, once again, funding. The root house I know right now is only a 10-bed facility for men, and the waiting list is huge. So when it boils down to getting more treatment options, I believe that there was or is a facility available in Portage County, but it all boiled down to not having it available because of funds. So as far as wishing that was there, that would be my wish, to have another facility for men and women to go to for detox purposes so that they're not detoxing in the jail, and for continuing treatment and getting them on the road to recovery.
Okay, in the interest of time, we are right at 4 o'clock. So panel, thank you very much.